Good afternoon. I wanted to take the opportunity, as we have been doing throughout the last week and a half, to provide update on the activities of the House of Representatives has taken this week and continue our efforts to provide information to people in the local community around the coronavirus or COVID-19. On Wednesday, my colleagues and I passed an $8.3 billion emergency supplemental appropriations bill to assure our communities have the resources necessary to respond to this public health emergency and do it effectively. The bill was bicameral, bipartisan. As I said, it was passed by the House on Wednesday. Yesterday, the United States Senate passed it, and the President signed it into law. It is comprised of entirely new funding, so there was some concern at the outset that it would take dollars away from existing public health programs. We did not do this. This is new funding, which I think is important. The funds are used in a number of different ways. First of all, $3 billion of it is earmarked for research and development of vaccines, therapeutics, and diagnostics. There's $2.2 billion in public health funding for prevention, preparedness, and response, $950 million of which will support state and local activities and health agencies conducting vital public health activities, including surveillance, laboratory testing, infection control, and more. Nearly $1 billion for procurement of pharmaceuticals and medical supplies to support health care preparedness and to support community health centers and to improve medical surge capacity. $61 million to facilitate the development and review of medical countermeasures, devices, therapies, vaccines, and help mitigate problems with our potential supply chain interruptions, which is obviously a very big deal. There's also an estimated $7 billion in low-interest loans for businesses, particularly small businesses, to help cushion the economic blow of this public health emergency. The package also supports a number of initiatives that I think are really important. One in particular will help Medicare providers to extend telemedicine and telehealth services to senior citizens that will allow them to stay in their homes but still be able to be connected to health care providers to make sure that we're doing primary care screenings, et cetera. That also helps to ensure that potentially infected people will be at home and will continue to be isolated and not infect other populations. We're helping to ensure vaccines and treatments for coronavirus are affordable, so co-pays, the kinds of co-insurance, out-of-pocket expenses will be limited, and that we will help ensure that state and local governments are reimbursed for those costs. I note that the state of New York has taken the lead on this by ensuring that in New York that health insurers will not pass along co-pays and co-insurance and out-of-pocket costs to individuals. This week I participated in a briefing with the Vice President as well as the team of people, including Ambassador Birx, who is leading up the effort for the White House and for the Vice President. Talked about the additional measures being taken, particularly such as having tests approved when a primary care provider authorizes them. There's still obviously significant questions about the number of tests available and how quickly the tests can be done. We talked about other things like medical supplies like masks, which are necessary for healthcare providers as well as people who have been tested positive. They're not necessary for people who have not been tested or have not had any illness, but they are very, very important, obviously, to healthcare providers. And the Vice President left our meeting and was flying to Minnesota, where he met with 3M about making sure not only the supply that we have, I think we have in reserve nearly 40 million masks, and they were talking to 3M and other providers about starting up the lines. Once the President signed the bill yesterday, that gave authorization for additional supplies to be created. I've continued to maintain ongoing contact with the Governor's office. I'm in constant communication with the County Executive. County Executive Bello has been outstanding in his not only being connected to us, but trying to make sure that we're in touch with all the different groups that we need to continue to be in touch with. Tomorrow we're meeting with a number of groups, and we're continuing to spread the word about the things that people should be doing. You know, again, we continue to stress to people that the risk of infection is low, but we want to make sure that people, while not panicking, are taking the necessary steps for proper hygiene, making sure that they're washing hands repeatedly and thoroughly, that they're not putting their hands to their face, something I'm advised to not do because I'm always touching my face, so people should be reminded not to do that. Please stay home if you're sick. If you have a cold, if you have any respiratory issues, stay home, work from home if you're well enough, but certainly stay home. The same is certainly true about our children. Make sure children don't go to school sick or suffering from respiratory issues. We'll continue to monitor the spread locally, statewide, nationally. We'll continue to communicate with our partners and continue to make information available. People should feel free to visit the CDC website. Feel free to visit my website, monroecounty.gov's website. They'll all have ways of making certain that the public is made available for information that's necessary, and also continue to safeguard the public and provide information. So I don't know if there's any questions, but we want to make sure we're continuing to be transparent in our activities.
Is there any idea yet how much money New York State will get or the local Monroe County will get?
No, we're working through that. I think it'll in part depend on what the costs are as a result of the virus. So there's obviously been a serious outbreak in Washington State and California. We have, I think, as of right now, 33 confirmed cases in New York. But it'll depend on the number of cases, but also it'll depend on the impact on the healthcare community. We're rushing to try to develop vaccines. I think there's still quite a while away before we can get vaccines tested. And with vaccines, hopefully, we'll also have therapies. So some of the money is going to go to that to try to reduce the time frame that would normally be the case of vaccines. So I think we're working through all that. As I said, there's also going to be dollars available to those small businesses who may have interruptions, and that'll be in the form of low-interest loans. So I think it'll depend on where the need is, and we want to make sure there's great enough flexibility to be able to provide resources, and we'll continue to monitor what the expenses are so that if additional dollars are necessary, we'll make those available as well. I think we're off to a really good start in terms of funding. We feel this is a robust amount of money that will be able to mitigate the costs being incurred by local governments, state governments, and continue to try to make sure that we're doing everything we can to be good stewards of the public resources and make sure that we're helping our partners.
Is there a hope that the U of R will be some of the money for research?
Well, certainly the U of R will be a place. There are a number of research facilities around the country that are offering their expertise. U of R has particular expertise in therapies and vaccines, et cetera, so I'm sure they're engaged. We're talking to the U of R. We're talking to Rochester Regional on an ongoing basis, so we're continuing to communicate with them. And yes, I think we can be very helpful here locally in terms of our research capabilities. And I will say the entire national network of universities, research centers, and pharmaceutical companies have really stepped up, and I think we're very, very grateful for all of the volunteering of effort that they've made and making themselves available. So, and yes, we'll be obviously providing resources to those academic and research institutions that are providing their assistance. So if we find that and some of this is still being worked out, we agreed to the dollars, and now we're continuing to work through to make sure the details, but there's a $7 billion low-interest loan for those small businesses who are disrupted as a result of the virus. And so many businesses, large and small, are starting to look at their employee manuals. We were doing it to look at preparedness for our office to make sure that we can enhance opportunities for telecommuting. So people can work at home where that's appropriate and where that can be done. So obviously a lot of small businesses are doing it, but there's going to be potentially significant disruptions not only to employees, but if you're a manufacturing company, you have supply chain, those supply chains are going to be disrupted. And so we're very, very aware of that. We want to make sure that we can help those small businesses that are affected get low-interest loans to help them get through this and get to a point where we're back to operating as normal as possible.
How simple would it be for those small businesses to apply for those loans?
Well, I think we're still in the midst of making sure those dollars are made available, so people should feel free to contact our office. As I said, the Center for Disease Control, we're in communication also with the Vice President's team, Vice President Pence, and making sure as those details become available, we're able to provide that information. So we'll be, I'm sure, hearing from small businesses that are affected. We're also reaching out to the Chamber of Commerce. We're meeting with local business leaders to make sure that we're communicating with them. And again, just providing information. Part of this, too, is it's an iterative process. So we're going to want to hear from those organizations, not only looking for money, but to make sure that we understand what the challenges are that they face so that we can meet those challenges and continue to adapt our response at the federal level to make sure it's consistent with local needs.
I don't know if you've heard Rockport might be an area for quarantine. Your thoughts on that?
Yeah, well, I have not heard from SUNY, State University of New York. Obviously, I've seen media reports, but no one has contacted our office, and there's been no official announcement of that. I do note that there are going to be places where people are quarantined, and that's going to become, particularly if we, well, we hope the virus doesn't spread. We are concerned that it will, and that's going to necessitate quarantines in some places. Some of it will be home quarantines. There may be other places set up quarantines around the country and around the state, but I have not heard anything officially or otherwise from SUNY, and obviously we're monitoring all of that and trying to make sure that we're in communication with people.
So, this money, can it help companies that are, a lot of their workforce, if they have to self-quarantine, they might lose somebody for 14 days?
Yeah, that's really where it's intended to, particularly for small businesses. If you have 5 or 6 employees and 2 or 3 of them have to be home, and that's a significant disruption, providing these low-interest loans to help them get through that period of time is going to be essential. Also for businesses that have supplies and their supply chain is cut off for a period of time, which might lessen their sales. Obviously, we're continuing to work through this, but $7 billion low-interest loan is a significant amount. I think it indicates how much the Congress and the White House feel this is an imperative. Look, we want everyone to be safe at the end of the day. We know this is going to have an impact economically on the country. That's why the Fed took the rather significant step of reducing the Fed interest rate by a full half point, which is an indication of how they want to continue to offer stimulus money during this. So I think we're just going to continue to monitor where the disruptions are and try to be as flexible as we can to be able to meet those needs around the country.
No, tell us what a state of emergency in New York State could look like.
Well, obviously, you know, that's up to the governor to declare. He has the ability to do it. We will work with the governor in his office. We're in communication with them now as with various state departments. And there are certain powers reserved to the governor, certain powers reserved to the federal government, certain powers reserved to our local partners. That's why I stay in touch with Adam Bello on a very regular basis. So everybody has different roles to play. Our role is to provide information, to use our partnership with the CDC and the National Institute of Health, to work with our partners in Congress, and then take that information, provide it to and communicate with the state and local governments and all the local entities that are affected, so we can take whatever messages back and continue to coordinate with them. So we'll continue to communicate with the state, and we'll see what steps are necessary. But I think it's been, you know, it's obviously we have not faced something like this before, so it's unprecedented. I appreciate it very much. The Vice President visiting with House Democrats the other day, along with his team, including Ambassador Binks, who's in charge of this, and so we'll continue to talk to them and find out what needs they have.
Thanks, guys.
Yeah, thank you guys.